Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
hormone replacement therapy is useful in all of the following conditions except hormone replacement therapy is useful in vaginal atrophy, flushing and osteoporosis, but it is not useful in coronary heart disease. Then hormone replacement therapy is indicated in osteoporosis, hot flushes and atrophic vaginitis. Then estrogen replacement for postmenopausal women causes an increase in triglycerides. Estrogen replacement in postmenopausal women causes an increase in triglycerides. Then estrogen administration in menopausal women increases the bone mass because estrogen will prevent osteoporosis by increasing the bone mass. Then true regarding the postmenopausal osteoporosis is postmenopausal osteoporosis, there is decreased vitamin D and there is decreased serum calcium is seen in postmenopausal osteoporosis. The non-hormonal drug which can prevent postmenopausal osteoporosis is alendronate, which is a bisphosphonate.
thank you for watching.